what creates the gapping at the level of the lower cervical. And for that, we have to do a little exercise together. So I'm going to ask you to touch the spinous of C2 and laterally bend your head. I remind you the spinous of C2 just below the inion. It's the first bump that you will feel below the head. So as you feel that spinous and you laterally bend your head toward the right, you can feel the spinous moving to the left. Right lateral bending, left motion of the spinous of C2. This is called automatic rotation. And it's created by the anatomy of the cervical spine that basically create that automatic rotation. Second element. Let's take a look at how we perform or we set up a technique in the lower cervical. What do? We laterally bend on one side and then we rotate on the opposite side during the thrust. What did we do? As I laterally bend, my spinous move toward the left if I laterally bend toward the right. But my contact is right here on the right, and I turn my neck toward the left, which brings my spinous toward the right. So as I adjust on the right side, the automatic rotation turns the spinous on the left, and I, the doctor, turn the spinous on the right. So those two rotations are opposite. What happens when two rotations opposite conflict each other? It's a little bit like the ball in a pool table. If you have two balls coming up together at same speed, boom, they bounce back together. No energy is lost, the energy is kept and separate between the two balls. At the level of the neck, that will create a separation of the facet. It's not all there. The facet, in order to separate correctly, needs something that triggers that separation. And for that, we have to look a little bit at the anatomy of the cervical spine, which is very different than the other level. There is a unique structure present in the cervical spine that is the uncinate process or joint of von Lütschka. And here on an antero-posterior view of the cervical spine, we can see that the body between C2 and C3 is shaped as a mortesis. And on each side of that mortesis, you have that little speculated area right here. It's called the uncinate process of the joint of von Lütschka. And they are a diarthrodial joint covered with cartilage. Now, if we move one vertebrae in relation to another vertebrae, rotate them, we will see that very quickly the joint of von Lütschka hit each other and the spine, the two vertebrae, tends to separate. So I repeat, as I rotate the inferior vertebrae on one side and the superior vertebrae on the other side, the two joints of von Lütschka initiate an elevation between, or a separation between the two vertebral body. In this case, if I hold C3 like that and C4 and turn it, and you can see they separate from each other. And basically, it's a separation of those two vertebrae initiated by the joint of von Lütschka when two rotations are in opposite directions. Demonstrated. One of the clinical interests, the main one I would say, is, have you ever tried to treat somebody below 12 years old? There is no infield, no cavitation will happen. Why that? Basically, because the uncus, the uncinate process, are not formed yet. They finish their formation at around 12 years of age. So it's completely useless to try to obtain a cavitation on a younger individual than 12 years old. That's a clinical interest that we should know.